On May 22, 2011, St. John's Regional Medical Center in the city of Joplin, Missouri, took a direct hit from an EF5 tornado. The force of the storm blew out the windows of the hospital, removed portions of the roof, and did devastating structural damage to the building. Still, in spite of the magnitude of this disaster, the response from the staff and the surrounding community was impressive. This response was possible because St. John's was prepared to face such a disaster. The hospital had in place a disaster plan that was available both electronically and in hard copies throughout the facility. They had performed many disaster drills involving all staff, including several earlier that year. The hospital had also collaborated in disaster preparations with the City of Joplin, Asper County, the Emergency Healthcare Coalition, and the State of Missouri. In the immediate aftermath of the storm, physicians and nurses attempted to care for patients amid the destruction, inserting chest tubes and bandaging wounds by the light of cell phones and flashlights. As the level of destruction became evident, evacuation seemed the only viable option. Patients were moved to staging areas, and with the help of volunteers using pickup trucks and SUVs, the entire hospital was evacuated within 90 minutes. Critically ill patients were moved to Freeman Hospital, a local competitor, while others were brought to St. John's nearby rehab hospital, which sustained less damage than the main hospital. Meanwhile, members of the community were triaged, treated, and sheltered at the Memorial Center, a local concert venue. Staff worked with their vendor, ROI, to obtain the necessary medical supplies and medications. In the next phase of response, St. John's staff sought a location to be used as a temporary care center. First, they worked with the Missouri Disaster Medical Assistance Team, which had set up a mobile medical unit nearby which could serve as a temporary hospital. This was gradually upgraded into a modular hospital with increased beds and services, including a behavioral health unit. This was used for several months until the completion of a component hospital, which will continue to serve as St. John's main facility until the opening of a full replacement hospital, scheduled for later this year. During this recovery period, Mercy Health Systems, St. John's parent company, invested $958 million into the community and its staff. It ensured that its employees continued to receive paychecks and created a program called Talent Share, which allows its employees to work at other hospitals and facilities in the area to help meet increasing demands. In addition to aid from its parent company, St. John's also was helped a great deal by volunteers and local resources, such as law enforcement, city government, and local emergency planners. An important lesson to keep in mind from this case is the importance of knowing and utilizing your resources. Being knowledgeable about useful resources, St. John's was able to benefit from the help of city management, the Missouri Disaster Medical Assistance Team, the National Guard, the Missouri Hospital Association, the Governor's Office, SEMA and FEMA, the U.S. Army Corps of Engineers, and federal agencies such as the Department of Health and Human Services, the Department of Homeland Security, the Centers for Medicare and Medicaid Services, and the Joint Commissions. Each of these groups was able to help in different ways because St. John's knew how and when to utilize these resources. The case of Joplin also shows us how great a help volunteers can be in the aftermath of a disaster. However, in order to utilize them to their full potential, policies should be in place that coordinate the activities of volunteers. Issues that should be addressed by these policies include identifying volunteer opportunities that expedite community involvement, encouraging involvement with existing community coalitions, spelling out volunteer liability issues, developing media and public education, developing a volunteer coordination team, identifying and training a leader for volunteer management, a process for volunteer registration, procedures for documentation of volunteer activities, a system for communication, a shutdown plan for volunteer activities, development and maintenance of a volunteer database, and the provision of services for volunteers, such as counseling, health screening, and mental health services. By having policies in place to address these issues, volunteers can be utilized safely, effectively, and efficiently in times of crisis. Nurses are another group who play a critical role in disaster preparedness. From prevention to recovery, the nursing process can be applied to all phases of a disaster. In order to have a positive impact, the nurse should understand the disaster cycle and be able to serve at all phases. The nurse should provide services that are within the scope of their practice. The nurse should also have clinical knowledge regarding the pathophysiology and epidemiology of disasters. Finally, the nurse should participate in the development of healthcare and disaster policy. Once a disaster plan has been formed, it must be evaluated for desired outcomes, including the following. The disaster plan makes risk reduction a priority. The disaster plan builds a culture of safety and resilience. The disaster plan strengthens preparedness for response at all levels. These are a few key goals that an effective disaster plan should achieve. Thank you for watching our presentation. Please consider the following questions while preparing your responses. Number 1. How would you determine whether standards of care need to be altered during a disaster? Number 2. Do you feel prepared to provide care in a variety of settings under challenging conditions? If not, how will you prepare? And number 3. How would you use your skills in epidemiology to identify and plan for health hazards during an emergency?